Good afternoon, everybody. Welcome to today's fourth webinar on ISSUP Nigeria's Knowledge Update Series. I'm Diana Crossan, the Events Manager for ISSUP Global, and I'd like to introduce you to Dr. Martin Ogwoji, the President of ISSUP Nigeria, and also a board member of ISSUP Global. And with no further ado, Dr. Ogwoji.
Thank you so much, Diana, for introducing us to this session. Hello, everyone. Good morning, good afternoon, good evening, depending on where you are joining us from. Thank you once again for joining us at this fourth session of ISSUP Nigerian chapter webinar tagged ISSUP Nigeria Knowledge Update Series. We're indeed glad you could join us. Today, we shall be looking at another very important topic, which is substance abuse among adolescents, the influence of sexual behaviors. And to lead us in today's discussion is Ikenna Molobe. And to join me in moderating this session is Dr. Bawo James. Bawo is the Public Relations Officer for ISSUP chapter. Bawo, you are most welcome.
Yeah, thank you, Dr. Martin. Thank you, everybody. Good morning, good afternoon for wherever you may be. It's another session for us today, and we are glad to have Dr. Ikenna Molobe with us. And he will be talking about a very interesting topic. And I think for substance use professionals, this is a topic we're quite interested in because many of us really find adolescents to be confusing. Before Dr. Ikenna, I don't know why I want to call him doctor today. Before Ikenna goes on to his topic, I will do a brief citation on him. And I would also ask the participants that if you have any questions, just put your question in the chat box. And at the end of his presentation, we will take all the questions as much as time will permit. So Ikenna Daniel Molobe is a social development consultant with functional expertise that has spanned over a decade in programs and research. He has spent a major part of his career in social interventions and public health activities, and having worked with both local and international organizations. Ikenna holds a M.Sc in public health from the University of Lagos and a bachelor's in applied microbiology from the Nnamdi Azikiwe University, Awka. He also holds a National Diploma in Science Laboratory Technology from the Institute of Management and Technology in Enugu. He has received advanced training courses in addiction research and pregnancy from the Morehouse School of Medicine in Georgia in the USA, as well as an executive course in human rights and drug policy at the University of Ghana School of Law. He has also received the UNODC DPTC training and the UNODC Policy Maker training on the nature, prevention, and treatment of drug use disorders. Ikenna has presented papers at international conferences and has published. Among this is a paper he presented at the NIDA International Forum in California, and also at the Tackling Doping in Sports conference in London, as well as the International Conference on Child Marriage in Melaka. He's also presented papers at the International Conference on Drugs and Young People, and he was a scholarship recipient as an international delegate at the Harm Reduction Conference in Porto, and then also attended the Drug Policy Reform Conference in Missouri, as well as the Global Conference on Drug Demand Reduction in Nairobi. He was lead guest editor of the special issue on addiction and substance abuse of the Science Journal of Public Health, and also a recipient of the 2018 UNODC Academic Research Grant. He co-founded the Unified Initiative for a Drug-Free Nigeria, where he currently serves as director. He also serves on the board of ISSUP Nigeria as treasurer, and is also a key contact person for Africa under the International Substance Abuse and Addiction Coalition, ISAC. So over to you, Ikenna.
Thank you, James. Thank you, Martin. And thank you, Diana. In today's webinar, we are going to discuss substance abuse among adolescents, the influence of sexual behavior. Like we all know, adolescence is a stage where teens experiment in life. So in this lecture, we are going to look at the learning outcomes. At the end of this lecture, participants will be able to identify reasons for early exposure and risky sexual behaviors in adolescents. Then establish the nexus between adolescent drugs and influence of sexual behaviors. Then identify consequences of substance abuse and risky sexual behaviors. Then there will also be a highlight on the consequences of teenage abortion. Then we also look at recommendations for prevention. Now, adolescents need accurate and comprehensive education about sexuality to practice healthy sexual behavior while growing up or becoming adults. Now, early exposure to sexual activity may lead to health and social problems. Most adolescents who engage in sexual activities abuse both prescribed drugs and psychoactive substances to enhance their sexual activity. Now, with free access to internet, of course, we know that we all have free access to internet, and teens can surf on the internet to discover substances or drugs to enhance sexual activity. And most times, these drugs are purchased through street drug vendors. And these drug vendors or street hawkers most often misinform the teens that the drugs help to enlarge the sexual organ in order to convince them to buy the drugs. In most developing countries, teens have been able to obtain prescription sexual enhancement drugs from the pharmacy shop without doctor's prescription. And teens have also developed a strong network of sex engagement on social media to connect to others and negotiate for physical visits on arrangements for sexual intercourse. In most of the time in our social media, you will notice that teens always engage themselves and discuss sex issues and also drugs that they can use to enhance their sexual performance. And in this process, they also discuss or exchange information on various drugs and substances they can use to enhance their sexual craving and activity. And drugs and substances are abused or misused without knowledge of the effects, risk, and health implications of the use. And in most of the time, most of these sexual acts is unprotected. Now we have various reasons for early exposure and risky sexual behavior in adolescents. Risky sexual behavior is defined as having multiple partners and having sex with strangers. Adolescents most likely to engage in early sexual activities in those with social, behavioral, or emotional problems. Like I listed all these exposures and behaviors that can lead teenagers to sexual, risky sexual behavior and the use of drugs, and all of them are linked together. Social, behavioral, and emotional problems can lead to risky sexual behaviors in adolescents. and those from low-income families. When we say those from low-income families, we know that they are vulnerable. They can also be fall victims of abuse, and most of them also fall victims of trafficking. And in this process, they are exposed to early sex. Then victims of physical and sexual abuse. Sexual abuse, for example, can lead someone, because once you are abused sexually, you have been exposed to early sex as regards to teens. So from there, most of them can start being engaged in sexual activities and the risky sexual behaviors in that. Then adolescents in families with marital discord and low levels of parental supervision. Then, of course, we know that exposure to magazines, movies, and internet pornography can lead to early sexual exposure. Then lack of information and misinformation, peer pressure, homelessness, and loneliness. Adolescent drugs and influence of sexual behaviors. Adolescents, out of ignorance, misinformation, and peer pressure, abuse various drugs and substances while engaging in sexual activities. Some have become sexually dependent, also dependent on drugs. Now, chemsex, which is part of sexualized drugs or use of drugs to enhance sexual activities. This is fast becoming a public health concern, and it is also becoming more prevalent among the gay community, and teens who engage in chemsex are more likely to engage in high-risk sexual behaviors. Now, adolescents who are involved in sexualized drugs or chemsex experiment sex under the influence of psychoactive substances, such as we have 5 major drugs that teens use in chemsex or sexualized drug. We have the methamphetamine, the mephedrone, then the gamma hydroxybutyrate, and the gamma butyrylactone, which is also known as GHB and GBL, then cocaine and ketamine. All these drugs, they all have their street names as well. Then, these drugs are taken on their own. Someone can take amphetamine, for example, to enhance his or her sexual performance. Then sometimes they take in combinations or together with other drugs, other recreational drugs such as ecstasy, marijuana, or alcohol to experiment sexual enhancement. Now, each of these drugs has very different mental and physical effects. Adolescents use these drugs to change the physical sensation they have during sex, such as increasing pleasure and their ability to have sex for long and often with multiple sexual partners, or to change their psychological experiences, such as increasing their confidence or removing inhibition. With the exception of ketamine, I'm going to explain those 5 drugs that I mentioned. Other drugs except ketamine are stimulants drugs, which means that they increase heart rate and blood pressure and trigger feelings of euphoria. Now, GHB and GBL, those drugs are stimulants and also depressants. I will explain that to you. They are stimulants, they can stimulate the central nervous system when they are taken in low dose, but in high doses, they depress the central nervous system. So, and when they depress the central nervous system, one can pass out. Of course, we're going to look at that. Then ketamine, let me go back. Ketamine is medically used to induce loss of consciousness, but people abuse this drug. And it is also a depressant, but teens use them because when they use it, they also have feeling of sexual craving. So that is why they also use this drug to enhance their sexual drugs. Then crystal methamphetamine, GHB, GBL, and methadone are also reported to facilitate feeling of sexual arousal, like I mentioned before. Then because these drugs heighten sexual arousal and facilitate longer sex sessions, it has paved way for chemsex parties, clubs, or private accommodation whereby fuel a quick turnover of sexual partners. Then other drugs can also be involved, such as Viagra and poppers. These drugs do not provide a high euphoria. Instead, they are considered casual addictions to the high that is associated with methadone, then GBL and crystal meth. Now, Viagra, as we know, is a sexual stimulant prescription drug, which is becoming widespread abuse among the male adolescent and has been found to be abused in combination with these psychoactive substances for sexual enhancement. Now, research that has been carried out has shown in Nigeria and other parts of West Africa that tramadol is widely abused by teens to delay ejaculation and prolong intercourse for sexual satisfaction. Now, if you study tramadol pharmacologically, you will notice that tramadol, which is a prescription opioid painkiller for moderate pain, has been found to have effect to prolong ejaculation. But the Food and Drug Administration has not approved tramadol for use for sexual enhancement because of the risk involved. As a narcotic drug, tramadol has a potential for abuse and can be dangerous in large doses. And those who misuse or abuse tramadol are at risk for developing an addiction as well. Now, sometimes dependence on some of these drugs can stimulate someone to commit sexual violence or rape. What we mean is that there is a connection between drugs and sexual violence. On the other hand, because these drugs can stimulate someone to have sexual craving or sexual urge, thereby there is tendency for someone who is on this drug to commit sexual violence or rape. But on the other hand, some of these drugs, such as GHB, can cause someone to pass out, most especially when it is taken in high doses, then leaving the person more vulnerable to sexual assault. Date rape drugs. GHB is a date rape drug. Ketamine is also a date rape drug, and rofinol. And most especially the rofinol has been discovered to be sometimes used by teen boys when they invite their teammates through their social media interaction. Then the use of sedative is also becoming more common, which is slipped into someone's drink in order to cause drowsiness and sometimes short memory loss. And as a result, he or she may be sexually assaulted or agree to have sex. And death threat drugs can be in form of powder, pills, capsule, or liquid form and have little or no taste, color, or odor. So sometimes when it's slipped or put into someone's drink, it's hardly for someone to notice that the drink has been drugged, and someone can take it and the effect of drug can manifest. One can pass out and somebody can take advantage of the person. Then sexualized drugs use can lead to more forceful sex than usual, as well as unprotected sex. Of course, you know that some of these drugs can cause impaired judgment, and someone who is on this drug may forget to use protection during sexual activity. Then consequences of substance abuse and risky sexual behavior. Taking all these drugs, there are consequences of it, and also involving yourself in risky sexual behavior, which is found in teens, that's the adolescents. Now, sexualized drugs use is associated with increased sexual risk behaviors and negative health outcomes. And the various reasons for this, such as possibly linked with HIV, hepatitis C, and other sexual transmitted infection. Through sex, one can contact HIV, hepatitis C, and sexually transmitted infection. And as well, these things also inject these drugs in the process. And also, of course, you know that they share needles and they can spread these diseases among themselves. Then we also have other consequences like physical and mental health effects of the drugs used. For example, in mental health could be confusion, paranoid, frightened, hallucination. Then fear of disclosure of infection and drug use to parents. Of course, we've noticed that teens, sometimes they have fear of disclosure of infection when they get this infection. And as a result, they miss the care or there is also reduced access to treatment. Then fear of disclosure leading to self-medication. When they contact these diseases like sexual transmitted infections, there is fear to disclose that they have these infections, and they go on into self-medication to treat the sexual transmitted infection, and misinformation resulting to misuse of medications to prevent pregnancy to occur is also has been observed as well, because as they engage in sexual activities also, because of misinformation, they take other drugs, even abuse them. Some of those drugs may be prescribed drugs in order to prevent pregnancy to occur. Then low performance in school. While taking of these drugs, of course, when someone is taking these drugs, it may result to low performance in school due to the effect of drugs, and thereby one can also drop out from school. There is also depression as a result of life setback and substance abuse other than for sexual activities also. Because when someone is also depressed, they also can be involved in taking of other or using other drugs as well. Then drug addiction, like I mentioned before, those drugs, one can be addicted to them. Then some sexual activities have resulted to pregnancy, and the girl partners who have also committed unsafe abortion. In this process, also, they also take drugs to remove pregnancy. They abuse a lot of drugs. And due to fear, studies have revealed that teens who are victims use all kinds of harmful substances or drugs, including psychotropic drugs, to induce abortion in cases of unwanted pregnancy, thereby exposing themselves to health hazard. There is a study that I conducted which revealed the most abortion substances used by the teens in Nigeria. In that research, we were able to find out that teens abuse more of herbal concussion to induce abortion, followed by synthetic substances. One of them is washing blue that they used. They also abuse psychotropic drugs to induce abortion and prescribed drugs. And these drugs, like we've also observed that it is easier for these teens to surf on the net to get the names of these drugs. And like I mentioned before, because of lack of regulation in pharmacy in most of the developing countries, some of these youths obtain these drugs and in the pharmacy without doctor's prescription, which is a problem that we are facing. Then we also have consequences of teenage abortion. One of them is infertility and damage to the vital organs in the body. There's some teens that have committed an unsafe abortion, experiencing post-abortion syndromes while passing through physical and emotional trauma, thereby can also be involved in drug and substance abuse. Then some have educational setback or have dropped out from school. Then emotional and psychological disturbances that follows after the abortion, known as post-abortion trauma effects, and disturbances are depression, isolation, drug use, and attempt to commit suicide. These post-abortion syndromes can cause mental ill health. Now, recommendations for prevention. In order to prevent drug use and risky sexual behavior among the adolescents, we recommend that parents and guardians should keep close to their children and provide them with care they need. What are those cares? Parents should be mindful on their children's use of internet, watching of movies, television, and magazines. Because most of these media, like the internet or the movies, show more of pornographic pictures, which can lead some of these teens to start experimenting and engage in risky sexual behavior, even exposure to early sex. Then parents should know the kinds of friends their children keep, and also maintain a good parent-child relationship. When you maintain a good parent-child relationship, you should also be able to discuss issues of sexuality with your children, and your children also will not have any fear to discuss any issue they have with you. Then parents and guardians should also monitor their child's social activities. When they are attending parties, you should also be able to know the kind of parties they attend and other social events. Then observe their child performance in school, which is very, very important. Adolescents should be provided with information and skills for taking care of their sexual health and help them make sound decisions now and in the future. And by providing information and skills to the adolescents, of course, this can be enhanced through peer education training, whereby the peers can also be trained to give education, sexuality education to their fellow peers as well. The training of teachers is also very important. Then also training of parents and guardians, because guardians and parents should also discuss sexuality education with their children, and also know how to observe their children, of course, and training of the community and religious leaders, which is also very important because they also have influence among these teenagers. Then sexuality education should be integrated into the confidential and longitudinal relationship the parents and guardians develop with children through the education children acquire in the school. And the society must be aware of the children's own attitude, belief, and values so that their effectiveness in discussing sexuality in the community setting is not limited. We also have teens that are out of school, which should not be left out. So out of school and also school-based intervention should be provided to provide opportunities for individual risk assessment or targeted preventive counseling. Then there is need to assess professional support adolescents who already have the problem of sexualized drug use. In this case, counselors and psychotherapists can assist as well, because most of them have already been involved in sexualized drugs. So counselors and psychotherapists should provide and engage the adolescent in counseling, which is very important, and also helping the families to discuss and identify issues and address these events. What we mean by this is that the family should also be involved when the counseling is going on in order to help their children or their teens to recover from this situation. Then provide of referral for possible rehabilitation and treatment for the adolescent recovery and well-being, which is also very important. So in conclusion, we can say that drugs and substance abuse is detrimental to health and should be avoided, while education is very important for the adolescents to get the right information, and the drug and substance abuse prevention should be integrated into sexual and reproductive health education for adolescents to reduce the risky sexual associated. I will also add that most of the curriculums that are used to train most of these adolescents, for example, the reproductive health curriculum, are found to be separate, to be on their own, and we also have curriculum on drug abuse prevention on their own. But what we are trying to suggest that drug abuse prevention curriculum should be merged or included into sexual reproductive health curriculum to educate these young people, and that should not be separated as well. So with this, I say thank you all for your attention and listening to this presentation. Thank you very much.
Thank you very much, Ikenna, for your presentation. I want to welcome and appreciate the participants that joined us for this webinar. It was interesting to see participants from Paraguay, from Egypt, and also from India, as well as other participants from Nigeria. Dr. Ikenna, there is a lot of feedback, and we have participants saying that your presentation was excellent, and we also emphasize what you have said, which is the fact that adolescents education programs are very, very, very important for addressing issues of sexuality and drugs in adolescents. We don't have any questions as yet. If you have a question, just type your question in the chat box so that we could forward it to Ikenna for him to answer. If there's an area that you're not clear about or you want comments on any particular area, please say so. There is a comment here, Ikenna. I would, what would be your take on it? Someone commented that problems that we have, it's better sometimes if vaccinations, for example, HPV vaccinations for adolescents when they come into the adolescent years, right? What are your comments about vaccinations? Is it something that is recommended? Is it something that should be inculcated?
Okay, should I go on with the?
Yes, go ahead, please.
Okay, thank you very much for that question. Like when I was concluding, I mentioned counseling. When we talk of counseling, we have also preventive counseling. Preventive counseling, apart from education, sexuality education, and also preventive counseling. That means the person, counseling done so that it will prevent the person from going into drugs.
Okay.
The education and the preventive counseling are the most important for adolescents at that level. So that is, to me, is most should be most recommended. Thank you.
Okay. Perhaps no. What the person who commented was talking about was that should we give adolescents vaccines that will, like for women, for girls, should we give them human papilloma virus vaccine, for example? You know, there's been a lot of talk that because of their high sexual activity and multiple sexual partners, like you say, should we routinely give vaccines to adolescent girls so that if they want to eventually, it's like saying that you are giving young boys condoms because you are worried about the fact that their sexual activity may lead them to sexually transmitted infections. So I just wanted to know whether you had any comment on that.
Yes, I understand your question. That's why I mentioned it's good to give vaccine, but sometimes that needs to also be evaluated.
Okay.
Not encourage promoting of giving of vaccine.
Okay.
I would encourage education first at that level and preventive counseling.
Okay.
First.
Okay.
Thank you.
Okay.
As a preventive measure.
So I would ask Ikenna, if people listening want to advise parents, I know you mentioned that parents should be advised to check on whatever their children are going through on the internet because of the risk that if the internet is not well monitored, there is a tendency for them to be exposed to age inappropriate material. So do you have any other suggestions for counselors or substance use professionals that they could deliver to parents? Because many times parents are saying, what did we miss? We don't allow him do this, we don't allow him do that. So any comments on that? What specific things can they deliver to parents aside of controlling internet use?
Okay, thank you very much for that question. Though it's becoming difficult to control children and teens to use internet, but as a parent, you should be able to monitor most especially the sites the children visit. And if there's a way to block some of those sites, if you have maybe a laptop with your children at home, if it's possible for you to block those sites, maybe the pornographic sites, so that they won't have access to it, and that will also work. But most important is to monitor what they watch or access on this internet.
Okay.
Sometimes it's not easy because we have had cases whereby even in most of these sites, whereby before getting access to the site, it's not controlled. They may ask to put your age if you're up to 18, to put your age. So if you put 18, of course, the site will open. But there's no control. We've had cases whereby teens of the age of 16, 12 years will just type in 18 and the site will open. So it is becoming difficult most of the times. I know the parents cannot monitor everything about their children, but they should observe all this and also continue to educate their children as well, and control their access to internet as well. Thank you.
Okay, we have a question here. Okay, first a comment that your comments about counseling is very is well taken, but that in our country, I'm sure the person is referring to Nigeria, counselors and psychotherapists are not as recognized as they should be. And so rather than prevention, people appreciate counselors more for treatment. So how can government policy, how can we change this, especially from government policy? That's one question for you.
Okay, thank you for that question. Well, in most of the developed countries, of course, most of these the counselors in the developed countries are licensed. I understand that most counselors in the developing countries, like in Nigeria, for example, are not licensed. So most people practice counseling even more than the extent they can also provide. So it's good for the government to regulate professionals like the counselors, the psychotherapists, so that there will be an effective delivery of services. Thank you.
Thank you. And one more question before I hand over to Dr. Martin. This person would like to know if you have any experience, the measures that he or she should take for teenagers who go to boarding school. Says, I meet my son after every 6 months. So are there things I should do or look out for my child who is in boarding school?
Okay, now we've carried out some research and we found out, I will give you an example, that we found out that even these children, when they are coming back to the dormitory, to the boarding school, and in most cases that we've observed where the teachers searched their luggage, they found some of these drugs like tramadol, which means they are using it. And we've carried out research on tramadol and found out that there are so many reasons why teens use this tramadol. I will give you an example. Of course, it makes them to be less hungry. So sometimes they can take just one square meal in a day. But the risk involved in taking, because one can be addicted to these drugs. So what the parents should do is that there should be a strong relationship between the parents and the teachers as well, so that they can work hand in hand to make sure that children are monitored, well educated, and whether we like it or not, sexuality education should be incorporated into the school curriculum, so that teens should be able to understand and be able to live a good sexual life as they grow up. So I would suggest that teachers and parents should develop a good relationship in order to monitor their children in the school.
Okay.
Thank you.
Thank you very much, Ikenna, for that contribution. And indeed, I think respondents as the Parents Teachers Associations are very good opportunities to implement these suggestions that you have talked about. So parents can talk to check if the school's curriculum has anything on sexuality and drug education, as well as increasing the relationship between parents and teachers. Dr. Martin, over to you.
Thank you. Yes, thank you so much, Ikenna, for the excellent presentation. And thank you, Bawo, for the moderation. Definitely, I will come back to you, Bawo, since we still have about 13 minutes or so. But just to make a quick comment on the recognition of counselors. And also, I appreciate your recommendation for the incorporation of to incorporate sexuality education in the school curriculum as part of public health. In addition to that, we also recommend or add that the school counselors should be trained, their capacity needs to improve to also be able to intervene in this area. And when we talk about recognizing different fields in terms of certification and so on, we also know that the field of substance addiction and so on is broad, that people need to actually receive the appropriate training to be able to function in different areas. And that is why in ISSUP, for example, we advocate for certification of even those in the field of the area of prevention, in the area of treatment, and so on. So in all of this, it is part of certification and quality service delivery, and it's very important. Also regulation, because you can only earn respect if you can demonstrate that the services you are rendering is based on scientific evidence, and that one is doing more good than harm. So that is very important. So putting it together, I would say that we should also advocate for capacity building to be able to function in different areas. Thank you once again, Ikenna, for the wonderful presentation. Participants, you will agree with me that the presenter identified reasons for early exposure and risky sexual behaviors in adolescents. And more importantly, establish the nexus between adolescent substance use and sexual behaviors. So why this is particularly important or significant is that drug control efforts, especially among the adolescents, need to put into consideration in developing a drug policy. In other words, the fact that sexual exploits and the need to address sexual inhibitions are risk factors to initiating substance use or even continuing to use psychoactive substances should be factored into preventive strategies as well as treatment of persons with substance use disorder. So that is very important. Like we always say, people don't just go out and start using psychoactive substances. They use it for one reason or the other. And until we begin to identify those risk factors, it becomes difficult for us to profile or address it in the most scientific ways, one of which is what you have identified, that some of these psychoactive substances actually enhance sexual activity. So if you have someone or there is someone there who is who is having some kind of sexual dysfunction, it also means that the person will want to look for something that will enhance his or her sexual, especially the men, enhance their sexual drive and so on. Of course, it's not excluded to men, even male and female. So in other words, until we begin to look at how to address these risk factors, and factor them into our prevention and treatment approaches or interventions, then it becomes difficult to address issue of substance use disorders in both sides or from both ends in a more holistic manner. So once again, thank you for your presentation. I will still go back to Bao in case there's any last minute question or a comment that maybe the participants have thrown into the chat box that we possibly need to quickly address before the end of time. Otherwise, we'll see how we wrap up this session. Ikenna, you may also still want to say one or two. Thank you.
Okay, thank you, Dr. Martin. We have a few comments. One comment is that sexual education does exist as part of the curriculum in secondary schools, for example, in Nigeria. The contention really is about the content of sexuality education, and also at what point should we introduce sexuality education. I know that many times when this is discussed, the average Nigerian sometimes may sway on either side of the seesaw, depending on things like religion, things like culture, and what have you. But I don't think there'll be much attention in the society that we live in today as regards drug education. Very, very important. I think many parents are considerably worried about the effect of drugs. And we thank you that you are pointing out that for adolescents, we must recognize that there is a connection between sexual exploration, sexual activity, as well as drug use. Okay, I've also, the person who asked the question about what to do for his teen who is in boarding school, he just said that he's from Tanzania, from Dar es Salaam, Tanzania, not in Nigeria. So I think the correction for that. And then the other would just be that, is there a possibility that there are opportunities for online training for parents? Because many of them would like to participate in learning about preventive approaches. And I think this is something that the president can comment about. At least letting them have the knowledge about prevention, particularly online. Is there a possibility for this? Thank you very much.
Thank you. Thank you. Okay, go on,
Okay, let me add one or two things. Like most of, I know that many people from different countries are part of these, are participating in this webinar. Most of the drugs that I've mentioned, remember that they all have, because you may not be aware of some of them, and you may be asking, are you sure this drug exists in my own country? You should be able to know that this drug, they all have their street names they use. And teens, apart from these drugs that I also mentioned, they also discover, they experiment, they also discover other drugs or substances that we may not be aware of. Okay. So there is need for research, so that we'll be able to, follow the trend, to understand the trend, also discover some of these drugs that they are using. And so it is very, very important. And like some of the drugs I also mentioned, they also exist in all the countries, if I would say, but we may not know that some of these drugs are there. So teens discover these drugs and they use them. And they also Because the internet, I will continue to mention, they source on the internet to get the names of these drugs and also where they can find it. And remember, they interact on the internet. And when they interact, they exchange information. So we have to be aware of that. Thank you.
Thank you. Dr. Martin?
Okay, thank you so much, Paul. Just to comment on the different street names and substances in different parts of the world, I must add that there is high level of ingenuity in substance use and abuse. So, so many things are being mixed and used, and at times you don't get to know them, either by street name or by law enforcement, or until maybe when someone who is suffering from some form of disorders eventually visit the hospital, you start, finding out what exactly the person takes and so on. And in some cases, they don't even know the chemical composition of what they have taken. So that is how, I won't say how bad the situation is, but that is also a challenge to practitioners in this field to be conscious of all of this, because at times, the little we know in terms of the different psychoactive substances, both the ones we know by their names and the ones that are not conventional in some terms, they are just too many at times. Even when you try to call their names, what it is called in a particular place is different from what it is called in another place. But what is important is also engage in this capacity building for professionals to be able to address issues, that will possibly make the adolescent or the target group not to engage in any form of psychoactive substances. And beyond that, science has also shown that once an individual engages in a particular psychoactive substance, the tendency is that the person engages in many more substances. So most studies have established that poly drug use is more of the norm as against exception. So in that case, efforts should be made towards building skills so that both from different angles, the family, the community settings, and different agents of socialization, in such a way that at least substance use become not that attractive, especially addressing the risk factors. So to go back to the question of whether there are online trainings, yes, ISSUP Nigeria chapter is working hard on that, in addition to organizations that are delivering online trainings. So you can also reach out to us and we'll guide you accordingly. Capacity building in different areas of intervention. Talked about community, family, school, and others. So I want to believe that that answers that. I think at this point it is almost time for us to say bye, because time, as we all know, is usually not our friend. On this note, I will say on behalf of the Board of Trustees and the Executive Council of ISSUP Nigeria chapter, I sincerely want to thank the speaker, Ikenna, for an excellent job. And I want to also thank Bawo for the excellent moderation. To the participants, thank you everyone for joining us. We do hope that you will be able to join us again in subsequent sessions. And the next one is coming up on the 25th of March 2021. 25th of March 2021. Please take note and keep the date. So to ISSUP Global, we are very much appreciative of your support. I will say thank you, particularly to Diana, who started this with us today. So to everyone, once again, thank you and bye for now. Thank you.